Perfect. All right, so we'll go ahead and get started. Welcome everybody to our Taylor County Medical Reserve Corps kickoff. We're real excited to have you here. We're going to be going through a little bit about what the MRC is, how you can, if you're interested, how you can get involved, and then we'll get people signed up today as well. So I will introduce myself, and then I'll have Dan introduce himself. I'm Melissa Moore. I'm a public health foundationalist with the Taylor County Health Department. For the last 23 plus years, I've worked in local public health. A lot of my time has been spent in engagement and getting people excited about things that they can do in the community to make it a better, safer, and healthier place. So that's kind of where I come at this. And Dan, would you like to introduce yourself?
Sure. My name is Dan Gellert. I'm the Emergency Management Director for Taylor County. And in partnership with the Health Department, we are kicking off our Medical Reserve Corps program, volunteer program and volunteer management. So exciting.
Right. So as we go, if you have any questions, those of you that are in attendance in person, those of you that are online, feel free to use the chat box. Dan will be watching that as we go. You can go ahead and dump questions in there. We'll have plenty of time. It's a small enough group. You can also unmute those of you that are online or use the hand raise, and then we'll go ahead and get your questions asked as we go. So I expect this to take less than a half an hour. We'll be very quick, concise. But again, we're more than willing to stick around after to have any questions that you may have answered. So welcome and thanks for taking some time to be with us today. So as a community engagement person, this is my mantra. There's no power for change greater than a community discovering what it cares about. And with the Medical Reserve Corps, we saw this as an opportunity we know people care about this community. We know people care about their neighbors and their family and their friends, and they want us to be the most healthy and prosperous that we possibly can. So when we look at this quote by Margaret Wheatley, this is really what drives us. This is what's driving our desire to create this Medical Reserve Corps. As Dan mentioned, this is something that we are doing in conjunction with the Health Department and Taylor County Emergency Management through the help of a new grant. This grant is called the MRC, or Medical Reserve Strong Grant. This is a federal grant that was awarded to the state of Wisconsin. We were invited to be part of, how many we had what, 8? 7? There are 7 different counties and organizations that were awarded. At the same time, we were in fall of 2023. So this process to get us set up, and we'll go through some of our objectives, the things that we have been working on, the things that we are moving towards. But it took us probably about 6 months after we got our award to actually get set up on a state level and on a federal level. So it did take us a little bit of time. So that's why it's taken us a little while. We're in fall of 2024. That's why it's taken us a little while to get to the point where we can do this outreach and really start to get people engaged and excited about this initiative. So the Medical Reserve Corps was actually started after 9/11. Just that little history. Within months of 9/11, on a federal level, they created the Medical Reserve Corps underneath the Administration for Strategic Preparedness and Response. And the goal of it is to be a community-based, civilian and volunteer-led program to help build our infrastructure, because we knew coming out of that, responding to emergencies, and in the event with 9/11. Shortly after that, we had things like ricin, we had different pandemics. We're now in my 4th pandemic and as an adult working in public health. So this is something that we know that the Medical Reserve Corps plays a very important role in our ability to be able to respond to those wide range of challenges as far as public health and health really in general. So there is more information on the ASPR website. This presentation, if you want it, we'll make it available to you. I'll also upload it with this video to our Taylor County Health Department YouTube channel, and we'll share it on our Facebook page as well. So you'll have this information ready in your hands for you. So our mission with the Taylor County MRC is to recruit, retain, and re-engage those that are trained professionals as well as volunteers to be able to respond in the event of a public health emergency or other community emergency. And in order to protect the health and safety for all of our residents and visitors in Taylor County. So it's not all about the emergencies. It's not all about if there's a storm or if we need to do a mass clinic. It could be, there's a run, there's a 5K, there's an outing, there's an event. Be able to help provide things like first aid, hand out waters. You know, there's a lot of ways that we can get involved. And we'll show you some of the ways that we've already started to promote the program at these events. But really our mission is to not only find new, keep what we have, but also those with the pandemic, we saw a lot of people fall off in their volunteerism. And for a variety of reasons. So we're trying to get back those 4 years that we lost, to be able to bring people back into the fold, to help get involved in the community. So when we wrote this grant, we had two focuses. We had, how do we build capacity within our community and within our organization, as well as how do we like strengthen our capabilities to be able to respond? Because we know that each community is different. Each community, each organization, if we don't have to Gilman or Jump River or Rib Lake, which is part of our goals to do outreach in the other municipalities within Taylor County. But we know that volunteer response is at noon. Taylor County is rich with volunteer response, whether it's the 911, the post 9/11 response, whether it's through our fire and EMS service, Weaver, which is the Wisconsin
Emergency Volunteer Registry.
Emergency and volunteer, there's an 8 in there.
You made me question myself.
Okay, well, we're gonna get to Weaver anyway coming up, but so Weaver's been around for a number of years as well. Those of you that have been connected to public health or human services, Weaver's been a part of it. And then also even HyperReach, which is our new co-brand emergency response system. When we have storms, which I'm looking out the window right now going, when is it gonna start to rain today? But, so we know that we have this capacity, we want to do more with it. And then when we look at our capabilities, it's about addressing health equity, it's about looking at disparities, people that maybe are at a disadvantage when it comes to things like emergency response, re-engaging people post-pandemic, and again, ensuring that we have coverage throughout Taylor County. Because we know that life happens outside of the city of Bedford. So for us, it's all about preparing, it's about responding, and it's about getting people ready to lead. There's a lot on some of these slides. Again, the slides will be available to you after the fact if you would like them. But in the end, our vision, we want to be better equipped to be able to respond to emergencies. We want to establish that system to be able to manage our volunteers and be able to not only bring in new, but then also re-engage those that maybe have fallen off. Maybe have a better understanding of the hazards and threats that face our community. So it could be something like where we are more prone to flooding. It could be somewhere where we know that we don't have as good an internet. How do we get people emergency notifications? Do we distribute weather radios? Just one example. Looking at building capacities for change, we know that some of this involves policy work, so some of this might be included in the work that we do in the future. And then again, how do we help those that are at higher risk? It could be our elderly, it could be those that have English as a second language. It could be people that have disabilities such as physical disabilities or hearing or vision disabilities. And then also to strengthen the relationships between our leaders and our stakeholders, because we know that you need resources to support this kind of outreach. And then lastly, to help build resilience across the lifespan. A lot of the times when we talk about resilience, I look at it as how you bounce. Those little bouncy balls we used to play with as a kid, or the little weeble wobbles that tip over. You know, how do we bounce up after we are faced with some sort of hardship or some sort of event that maybe cause us to have more hardships or more difficulties? So this is part of when I say that we have a lot on some of the slides. This is actually from our strategic plan. So those of you that want to know more about our strategic plan, we'd be delighted to share that with you. I did forget to bring cards up, but you can reach us by any of the handouts and pamphlets we have in-house. Those of you that are online, we'll make sure that you get this information as well. So stick around at the end, we'll make sure we get those in the chat. So we want to, again, understand our communities, be able to assess and address the health and safety concerns. Looking at the trainings, that's one of the perks of our MRC program. We offer a lot of free trainings to use things like basic CPR and AED. For example, we'd offer for free as a part of our MRC program, and other trainings that we have available in the community, which we'll go over in just a few slides. To be able to look at we know that we need people to help lead this. Dan and I are both have other strategy things that we have to work on. How are we gonna be able to maybe bring on a contractual staff? We had a great intern this last summer. He was able to do a lot of work for us underneath this program. So can we bring another intern or casual position in to help support our MRC outreach and initiatives? And then also to look at things like our plans, our strategic plan, our communications plan. How do we let people know what it is that we're gonna do over the next few years? And then looking at the recruitment of medical and non-medical volunteers. So I'm gonna break down what the two areas are, and they both have such an important role in the work of the MRC. So it's something to Medical Reserve Corps is the name of it, but we know that it's more than just medical. And then also to get out to the rural communities, to get those that maybe have different barriers to get involved, barriers to get into the response that we may need. And then look at how we can get our stakeholders and our target populations more engaged. And how do we keep it around? This is a 2-year grant, we're in our 2nd year. So any questions so far on kind of the what's? Now we're gonna get into the hows. Any questions online yet?
Not at this time.
Okay. So again, when we look at the AmeriCorps program, it's about how to prepare to respond and how do we lead those efforts. So some of those benefits of the MRC, getting involved in the MRC program, obviously sway. For those of you that are involved, you can sign up and participate in our trainings. You get one of these fancy MRC t-shirts. They got the back, yes, ooh, da. So here, when you're out, thank you everybody online, you're welcome. But you will get benefits in that way. You'll get some of these different, essentially, ways to help promote the program, but then also show that you're part of that program. This is a flexibility. People can participate and engage when they can, where they can, recognizing that not everybody can do everything all the time. This could be a call out to volunteers to help with. We're at the Walk Together for Suicide Prevention, the mental health awareness walk. This could be, is anybody able to help hand out water at the event? It's as easy as that. We're gonna have a training coming up on scam protections for our seniors. Again, another high risk response type of opportunity. You can attend if you're able. It's another way to give back to the communities that we have invested so much of our time and energy and love for. In addition to the free trainings that we're going to be offering, for those of you that are looking to build your resumes, an opportunity to show your volunteer opportunities, and as well as career opportunities. Thinking about the diverse group of people that we imagine are going to be a part of this, that are part of this, that are part of our volunteer network. It may be a way to connect with others that may give you another opportunity to volunteer or another way to connect in a career sense as well. So the who's do we needs, it's my very well-spoken moment here. So we have our medical professionals, so those that are credentialed in the state of Wisconsin or another entity. They're able to provide medical care to residents, visitors, and animals. So they may be nurses, dentists, physicians, counselors, pharmacists, veterinarians. We know that in emergency response, it isn't all hands on deck. So this is some of the examples of the medical professionals that we would have as part of this. But our non-medical professionals, these volunteers can be in all areas of the community and are essential to that response. Both again, emergency and non-emergency efforts. This could be people to provide driving services. This could be our interpreters or help connect people with interpreters. These could be office workers, legal advisors, radio operators, any of our basic needs organizations or service providers to be on hand to help connect people with the resources they need. Again, when we're in an emergency situation, especially, we need people around us. We need that kind of bubble wrap, if you will, to help us be more resilient. And then some of the other ones that I have listed here is chaplains or other spiritual advisors. And then those that are maybe really good at logistics and administration, help us with keeping track of our inventory if we're doing a shelter, for example, or checking people in, or just having good customer service skills. Because the first person you see when you're coming to a shelter needs to be somebody that is warm, passionate, and there to help you. And those are some things that it doesn't matter which area you fall in, whether it's medical or non-medical. That is something that we are going to be really encouraging and enforcing, because we know if you've ever been in any sort of emergent situation, how important that is. All our volunteers will be going through the Wisconsin Emergency Assistance Volunteer Registry. You know, there's an A in there somewhere. So Weaver is actually something that started a number of years ago. I don't think I can put exact date on it, but it's within my professional lifetime. I believe it did start with the swine flu back in 2008. So Weaver is a database where you put your information in, it does all the background checks for you. So both of those that are credentialed, so if you hold a license as a nurse or a physician or a pharmacist, it'll go through and confirm your licensure status. And then also for those that are not medical or hold some sort of licensure certificate, it also goes through the background checks. Because again, we know it's important that as we're responding to an emergency or non-emergent situation, that we need to make sure that we have people that are checked to be part of it. It's good practice. And plus, I think it helps the community to know that we have people that are there to help and that have been their backgrounds and helps build that trust. So through the Weaver system, it's a number of questions similar to what we have on our check-in or registration form, which is available on the Facebook page, as well as again, we'll be sending it out after the fact. So those of you that are in the room, we'll probably make sure if you did register, we get your emails. Those of you that are online, you would have had to register, so I would have your email so we could follow up with the email after the session today. So in addition to just all the fields, these are some of the trainings that are included with our MRC program. The ones that we were requiring of those that are volunteers, ICS 100, ICS 200, NIM 700, those are all available online. Dan and me maybe as backup, Dan's the guy. He can help get people set up. Those are all online trainings, those are all self-paced trainings. They're really not that bad. They're actually very good. And then also the basic CPR AED training. We have a couple people in the community that are trained to be able to offer that. And those are the 4 that we're requiring of everybody that's part of our MRC, officially part of our MRC program. Once you complete those trainings, that's when you get indoctrinated with the fancy swag. That kind of the point where when you invest that time, then that's when we can give you that. Other community response trainings, such as crisis and emergency response, or CERT trainings, our overdose prevention trainings, our secondary traumatic stress or suicide prevention, this is a question, persuade, refer. All those trainings are things that we offer ongoing at no cost. So once we get our MRC going, we'll be offering some of these trainings more and more often. In addition to any trainings that we've offered or will offer, we've got a number of trainings up on the Health Department, Taylor County Health Department YouTube channel, but then also any trainings that come along the pipe. If we can get people trained in communications, then we have more capacity to be able to do more outreach like this, presenting into the community, more outreach to present to media, and then looking at some of our planning and evaluation and grant writing. All these things are going to be important to the sustainability of our work.
The basic CPR first aid training could be something that we do as a group, as like a meeting. So if we don't have it right away, we will provide that for you here, obviously no cost as part of the group. So that's one of the trainings that we can provide as a group when we get going.
Absolutely. Absolutely. And then these are just some examples of some of the activities that MRC units can go into or volunteer with. In the state of Wisconsin, we've had both, like the Republican National Convention, Milwaukee, MRC units were deployed there to help with any sort of first aid needs or crowd needs. We also see things like drills and exercises. We get invited throughout the state to be part of shelter drills. How do we provide shelter in the event of a tornado or any sort of mass event? So these are just some of the examples. Again, the Asper site has a lot more around what MRCs do and don't do. But this is just, currently, we've really done a lot just around that, getting the word out about the organization and providing some of that basic first aid at different events. But again, it could be so much more than that. Somebody can see that. Okay. Just some different events that we've been at already this year with this organization. We've held events targeted with our seniors around how to prepare in the event of an emergency. We've put up booths at the Fair Before the Fair, Commission on Aging. We've put up booths at Park Fest, and a medical tent at Park Fest. We've been part of the National Night Out, which was held in August. And then, as I mentioned, we were at the Prevent Suicide Taylor County Walk Together event just this last week. It helped provide waters and handed out hand fans and things like naloxone and penicillin and gun locks to attendees. So this is just some of the little things, like I said, having volunteers on hand is so super important to us be able to get the word out about this group. And, you know, we never know when an emergency will pop up, we just haven't had to deploy anybody yet. And then another piece of our work is around the overdose pandemic, overdose crisis or epidemic. This is just a graph from the overdose prevention strategy that comes from the United States Health and Human Services. So we are part of, and through our grant, we're able to do things like stock our downstairs in the rental is one of our public health vending machines with things like Narcan, condoms, gun locks, fentanyl test strips, medication bags, and the first aid kits with the CPR mask. We also have one over in human services, and we're looking at adding a third in our community over the next few months. So this is part of our response because we know this is a national need. So a lot of MRCs are part of this. So if people want to get trained to do overdose prevention trainings through the MRC, that is something that we can do and provide. So with that, we'll put this page up again. This is the information that was part of our ad or part of the advertising of this. We have cards up here. We have scan codes. We've got things all over the place. But we're just encouraging people to sign up. Weaver is probably the quickest way you can get completely signed up because it goes through and gets you to the point where you can check the box for your background screening. If you fill out the short link at the bottom or scan the code, then that actually has you fill out our form, and then we'll reach out to you to help complete the rest. So we do have forms here today. If people want to fill out paper forms here today, those of you that are online, you can go to the Weaver link, which is right here on this slide. So that's kind of the quickest way to get people set up. And like I said, for us, this kickoff is about getting people excited about this, getting any questions answered, and really helping to build that base. So in the event that we do have something that we need to do a call out, we can do that. And that call out would come through that HyperReach system. So anybody that isn't currently on that HyperReach system, so if there's a tornado warning, you get a phone call, you may get a text, you may get an email, you may get all three. That all comes through Dan. But if you're not on those already, then that would be part of that sign up for the MRC program as well. Because that is how we're planning on doing a lot of that.
Not HyperReach is on the base page of Taylor County.
Yeah.
Yeah, well, and then your information would be just put in a different category, so when we do call outs or, you know, training reminders, it doesn't get blasted to the whole county, gets that message, it would be the certain group.
Yep. So everybody will get, yeah, you'll all be part of our Taylor County MRC group, our notification group. Another way for people to get involved is to like and share the Taylor County MRC Facebook page. This is a screenshot from a few days ago, so I'm hoping that we'll get more likes, more followers. We're just starting to really promote this page to the community. And for those of you that are online, that scan code is the same as the link that's there. But if you type up Taylor CO MRC, you should be able to find us. And I'm going to leave it on this page. We'll go for questions, but you know, this code is probably one when you talk about engagement on her being famed anthropologist. She is all about understanding how we as the social setups, how we can make change in the world. And her quote here, "Never doubt a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has," really speaks to our goal of the MRC program. So again, I've got the Weaver page up. here, so if people want to sign up, we can sign up with that, or we can sign up with forms. And then I will end with Dan and my information, but is there any questions? Online or in the room?
So if there's an event, we could email or something, or text or whatever, is that how that's gonna happen?
If however you want to, you select your notifications to come.
Oh, and then if we acknowledge whether we're gonna respond or not, I'm assuming.
Yeah,
It's
so,
not required.
no, it's not required. So if, we'll throw a thing out there, say we need, the MRC group to stand up. You know, there would be a message that would go out and it would be a poll form, you know, are you able to respond? Yes, no, you know, press 1 for yes, 2 for no. And that information comes back to us saying, hey, we've got, you know, 15 people that are available out of our dream of 200. I'm shooting somewhere.
But yeah, it could be, you know, we're gonna be opening up a shelter at, you know, Emmanuel Lutheran Church. We're gonna respond to make yes or no and report at 7 p.m. And then we'll have a staging area and then people will get their pieces.
We're going to do these, presentations in Yelman and the.
That is our plan. So the question was if we're gonna do the presentations in other areas of the county, absolutely, yep. Yep, our plan is to bring this out. I'm thinking, you know, we'll have to see what's the best time, if it's at things like the fire EMS meetings, or if it's at the municipal board meetings, or if it's just something separate. So people do have feedback on that. We'd love to hear that feedback. What's the best way to get people to attend to listen on these sessions?
So we have a question online, how often are our meetings? So we haven't really set up meetings. This is our first kickoff meeting, get people engaged, involved. We do have a small number of people that are signed up for the program yet. And that's something, once we get going a little bit more, is to say, hey, how do you want to meet? Do we want to do monthly, bi-monthly, quarterly, you know, kind of check-ins? You know, having this program up, it's something new. But we want to also keep people engaged in being able to do something. Emergencies don't happen every day. That, you know, we want you guys to still be engaged, keeping skills up to date, knowing what to do, you know, eventually down the road, setting up a shelter, you know, a reception center, something like that, you know, getting you guys engaged on what can you do? How can you help? What is the way that you want to see this program go? Do we just want to look at it being strictly medical? Do we want to look on the side of, you know, helping out at, say, a fire scene with rehab, stuff like that? So it's all depending on kind of how we want to build this program, is how we're looking at it.
And also, the goal in our training is that we offer at least one training each quarter. And for when we look at a big pile of recruits that need the AED CPR to be able to offer multiple opportunities to attend those sessions as well. Those will probably be twice a year. I would think we probably offer those to our MRC, unless we have a large influx of volunteers coming in all at once. So the trainings are going to be there. You know, the meetings themselves, like Dan said, it's just going to depend on what our volunteer base looks like. And we'll probably be looking at doing at least one exercise a year. We'll do practice, like can you respond more often than that, just to test out our system and make sure everybody's information is still correct. But we'll probably look at doing at least one drill a year. Or joining another county's drill, which is what we tried to do just to kind of see how they've been doing their drills so far.
Anybody else online or in the room have questions or potential expectations of the program?
I just have a comment. I just think it's nice that one of the things that you thought about was like events like the first aid station, because I know there's a couple of events coming in this winter actually that it might be advantageous for folks to be involved in.
Absolutely. So just in case you didn't hear that comment online, that there's appreciation for being able to be available for events to help provide things like first aid at them. That would be beneficial for those that attend and for the planning as well.
I just have a comment, I used to work in the hospital for many years, and one of my favorite things that I used to say is expect the unexpected. Because you can't ever find, if you don't have something like this started, when something does happen, you don't have anything in place to survive and to, help. So I really applaud to resign and really getting started. I think it's so needed and so important.
Thank you. So for those of you online, just in case you didn't hear, appreciation for getting this started because we never know when emergencies are going to pop up. Absolutely,
like
it's
to
the
say more.
chaos today. It always happens at once, right? Who doesn't need a snowstorm, no power, and you can't get through the roads? But, I mean, that's kind of what we're facing, so. Any other questions online, comments, questions in the room? Okay, so I'm just gonna leave up, this is Dan and my information. So if you ever have any questions, of course, I'd be bringing cards up.
I have my non-comment.
Perfect, Dan has his. Dan is on it. You can definitely reach out to us. If you have any questions, if you wanna kind of hold off and think about it more, check out check out the Facebook page for the Taylor County MRC. And also for Weaver, we do have plenty of laptops here. If people want to stick around for a few minutes to sign up. Dan, you put the Weaver link in the chat.
I did.
Perfect. Anybody online, you can sign up through Weaver on the chat. And, we'll be in touch because it's just kick off. It's just getting started. We'll bring people together and do some outreach over the next month or so to really look at what training needs we have and how we can get up and get started right away.
For the people online, we have your email address, people in the room. I might just have you re-sign next to your name in the evening session. Just put your email in there, your best contact. If it's something that you continue want to do, we would definitely throw that email back out saying, hey, we're going to do a kickoff meeting or a first meeting to get people's thoughts and opinions. And I'm assuming we want to make sure that we're hitting everybody, so we might do a hybrid, because we can't reach everybody or can't have everybody in the same room at the same time. But if you're, on your way home from work at say 6 o'clock or something like that, you can at least chime in and be in the know.
Awesome. Well, thank you, everybody that joined us online. We appreciate it. Thank you for taking the time out of today. If you know anybody else that you think might want to be involved in this work, please have them reach out or have them attend our evening session here coming up. We're going to have another one at 6 in the PM. Save that channel, about a half an hour. Thanks, everyone.
Thanks much. Just stop recording, or I think we are. Oh, we're still recording.
You just hit pause.